Hi, my name is Maren Lowry. I'm one of our social workers and I'm the intake manager here at Buena Vista Hospice. So basically what I do is I handle any inquiries about hospice, new referrals that come in for hospice patients, and then also getting the admission process coordinated so someone can come on to service with us. So this is probably the question I hear the most is what's the difference between home health and hospice, and how do you know which one to go for? So Medicare and Medicaid provide two different types of in-home nursing services for their patients. The one benefit is called home health and the other is hospice. So our services look fairly similar. They're in-home nurses who are going to come and provide a skilled need for someone who has an illness. The difference between the two is their goal, okay? Home health is aimed at stabilizing and rehabilitating a person. So like if someone's fallen and broken a hip, or they've had a stroke and they need physical therapy, they need occupational therapy, then they would be appropriate for home health to come out and help them to get stronger and get better. Hospice is when someone is in a failing condition. So they either have a terminal illness or terminal failure. And so our goal is not to rehabilitate, our goal is just to provide comfort. And so that's when we know that it's time to say, am I trying to get stronger or am I just going to focus on being comfortable? We're not going to push mom to get up and walk and eat and do these things. We're just going to focus on having the nurses come in, visit, and make sure she's comfortable and under control. That's kind of the difference between the two and how you know whether or not it's time for hospice. So both of them require a physician's order. So both of them would be indicated by your primary doctor who would say, let's go ahead and write you an order for home health, or let's write you an order for hospice. So there is a myth that you have to have an overriding terminal diagnosis like cancer in order to be eligible for hospice services. The hospice benefit is intended for someone who is in the final phase of life. So that means that they either have a terminal diagnosis like cancer, some end-stage chronic illness, or their body's showing us signs of terminal failure, okay? So in general, there's sort of three buckets that can qualify a person for hospice. The first would be cancer diagnoses. When you've reached the end of your treatment options, or you've decided that the treatment options are too harsh and you'd rather just be home and comfortable. The second bucket would be end-stage chronic illnesses. That's things like end-stage renal disease, and it's time to stop dialysis, end-stage heart failure, end-stage pulmonary disease where you're having difficulty breathing and you're now homebound. The third category that I like to call the little old lady category, right, is kind of just general decline. And what that means is there's not any one major thing, but there's a lot of little things going on. And what we're looking at there is to see, is there a decline in functioning, the day-to-day, bathing yourself, feeding yourself, getting out of bed yourself, you need more help? Has there been a lot of hospitalizations, recurrent infections, recurrent bed sores? Different signs that your body is telling us that it's wearing down and starting to fail. So when you're determining whether or not it's time for hospice, any one of these categories could qualify someone. So the best thing to do is discuss with your physician, get an order, and then call us. And we're happy to come out and meet people all the time and let you know what, it looks like it's time. Or, you know what, it's not quite time yet. Let's give it a few weeks or a few months and check in later. In order to initiate hospice services, we need to have an order from a physician. The order is just written on a little tiny prescription pad, like you get any prescription, and it should say hospice evaluation. So you can discuss that with your primary doctor and get that, and that's all we need to get the ball rolling. From there, we can come out and set up to do an evaluation, talk about hospice services, see if now is really the appropriate time, and then proceed with admitting if everybody's on board. So even without that hospice evaluation, we're also happy to come out and meet families at any time and talk about our services. We call that a meet and greet. And so we do a lot of that because we know people get nervous about hospice, and it's sort of scary, or different family members, some family members may be on board and others might be nervous about it. So don't be afraid to call us, and we can come out and we can meet with you, and you can get to know us and see that we're not scary and kind of see what the process is, and then down the road when you really do need us, it feels a lot more comfortable. So just call anytime and we can go from there. Our office is open from 8:30 a.m. until 5:30 p.m. That is the best time to make an inquiry call about new services. We're fully staffed at that time, and there's always a social worker in the intake department to help you. We are, however, available 24 hours a day, 7 days a week. We always have an on-call service and an on-call social worker who can answer your questions. So if there's a crisis situation and you need to call us at night or on the weekend, you can certainly do that, and someone will get back to you, usually within a half hour. But the best time to get the ball rolling would be during the regular business hours, when we can get a hold of your primary doctor and get the information that we need, to set up. We have staff, obviously English-speaking staff, and then fluent in Spanish staff. If there are other languages, we do have a language translation line that we can use if needed, or we kind of use like our resources in the community to see if there's someone who can help us.